and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live and to Ask Dr. Doreen. I'm Shannon Penrod and we're coming to you live from many places around the country today. Dr. Doreen Granpeesheh is here with us, as you can see. Good morning, Dr. Granpeesheh.
Good morning, Shannon. Good morning, everyone.
So excited that it's Wednesday and we get to have her wisdom with us. For those of you who are new to the program, Dr. Granpeesheh is a true expert in the field of autism. She joins us on Wednesdays whenever she can, and we open up our chat and ask you to write in your thoughts, your questions, your feelings, your concerns. Dr. Granpeesheh has been working in the field of autism for 30 years, and you would never believe it because she looks so fabulous. I think working with young people keeps you young, so we should all go take a job working with young people right now. But anyway, there's so many things that I love about this amazing expert, but just one of them is that she has such vast knowledge from everywhere from working with young babies up through senior citizens. So I know sometimes you guys write in and you go, is this a program for 3-year-olds or is this a program for older individuals on the spectrum? Certainly today we have an expert who can talk to you about everywhere on the spectrum, people who are what is considered high functioning and just need a little bit of support, and those who are greatly impacted. So thrilled that she is here and can help answer these questions for you. We do like to remind you, our disclaimer at the start of the show is there is no expert in this field or any other field that could give individual specific advice in this format. Dr. Granpeesheh she's not able to have eyes on the situation. It would be a disservice to the individuals that we're talking about for us to pretend otherwise. But please feel free to write in, whether you are the person on the spectrum or it's someone you love, write in and tell us what's going on. Dr. Granpeesheh will give you the benefit of years and years of experience so that you can go back and ask the right question of the experts who have eyes on the situation. So having said that, I also want you to know that Dr. Granpeesheh is the founder of the Center for Autism and Related Disorders, but also the founder of a wonderful charity organization, Autism Care Today, that's given away, I think it's over $2 million worth of grants at this point. Correct me if I'm wrong, Dr. Granpeesheh. So, in addition to her work, which has been amazing and changed lives, my life, my son's life included among those, she's found the way to be extremely helpful and supportive in many different ways. So Dr. Granpeesheh, good morning and welcome.
Thank you so much, Shannon. You always say the kindest things about me, and I love you. Thank you very much. And yeah, ACT has given away somewhere around the 2 million mark, and we're very happy about that, and we're still working hard to do that. Especially during the last year, we've been focused on, usually ACT, of course, Autism Care Today gives funding for our children, and we're still doing a lot of that, but our focus over the last year or so, I will say, has been more focused on the family as a whole, and particularly we started just sending out kind of grocery gift cards and just funds for families who had lost their jobs or were having a really hard time with just putting food on the table. So that has been our focus. We also, over the past year, gave out a lot of iPads. I'm not sure exactly how many, but I think more than 50 or so iPads, because we know that there were a lot of children who needed those iPads just to do distance learning or to do some form of telehealth. So, and we're not a big foundation, but we do what we can, and we're very blessed to be able to help families, and I love doing that still.
Amen to that. And I want to say, if you're watching right now and you have cleaned out your couch cushions lately and maybe you have $5 to give, it's a wonderful way to support the autism community. You can make a donation. You can go to act-today.org. So that's act-today.org and make a donation of any size. They are a registered 501c3, so it is a tax deductible donation. And you can say what you'd like for it to go to, but it is a wonderful way to give back. And I can tell you that when you're in the space and find a way to give back in any way, whether it's your time, your energy, your money, I think it makes the load easier. It's the quickest way I know to get out of a funk. If you're feeling like, nothing ever changes, nothing is ever better. The first thing to do is do something for somebody else, and quickly things start to turn around for you.
So
hey,
true.
I didn't really say at the beginning, but we said we want to know your thoughts, feelings, and questions, and I didn't remind you how you can do that. Right now, we are live on Facebook, YouTube, and Twitter. You can be writing in on any of those platforms. We're also live on a bunch of other places like Vaughn Live. Welcome to those of you, Africa TV, and many others. We hope that you will write in whatever way is convenient, but I will tell you that those big three, Facebook, YouTube, and Twitter, are the most, instantaneous. That's the word that I want. We're saying hi to Sam, to Christina, and Yasmin. We're going to get started here with some questions. If you're watching us in podcast, because many of you aren't available to watch us live, we are available wherever you get your podcasts. You can always write in. In fact, some of the questions we're going to start with today are from our live feature on our homepage. It is not interactive. When you write in, don't expect for someone to write you back. We answer the questions here on the show, but that's available 24 hours a day. 6 days a week, 7 days a week. There's 7 days in the week. It's available all the time. I'm just reading what Sam is saying. Hello. Sam, we did not get your, I did not get your email. So if you emailed me something, let's double check. My email is s.penrod@autism-live.com. And I did not get an email from you, Sam. So, feel free to email me again. There it is on the screen, s.penrod@autism-live.com. Now, Dr. Grampiche, I got to start with a question today, because so often we talk about on this show, we always say that this show is meant for the larger autism community. That starts with the people on the autism spectrum, of course, but it includes everyone who loves them. And often we hear from parents and caregivers. More and more we hear from the individuals who are on the autism spectrum themselves. Occasionally we hear from a teacher or someone who is working in the field of autism. But there's another category of people that we would love to hear more from. So I want to honor that by starting with a question from a sibling.
Oh, nice.
Because this is a very specific road. And for those of you who are not a sibling, I want you to hear this and imagine if the sibling in your life was saying this, because I want to be supportive. Now, this is from a young person who's still living at home with their sibling, and there is some language in it. I'm going to refrain from saying the language, but give you an idea of what the language is, okay? And I got a plane going overhead, sorry. My brother, 14 years old, has autism and ADHD, as well as some other things that aren't currently important. His special interest is cats. We have a few, and I understand that he likes talking about them, but every single conversation somehow delves into him talking about cats. I'm not being dramatic. You can ask him anything, and his response will somehow be related to cats, delve into the conversation of cats. It's maddening. Earlier today, I was trying to eat breakfast, and he went off on some tangent about cat genetics. I was seriously trying to ignore him, but for whatever reason, it was just on my nerves. I hate that I have to go eat alone so that I can eat peacefully. And I said, word for word, shut up. Nobody cares about cats. It's effing annoying. My parents saw red, and my brother was quiet. We managed to finish breakfast before they said anything, despite the fact that my parents were trying to burn holes into me with their glares. This is their words. I love it. It was, honest to God, the most peaceful breakfast that I ever had. They basically, right? They basically grounded me until they think I've learned my lesson. So I'll probably be grounded until they forget that I'm supposed to be grounded. They're calling me ableist while ignoring the fact that I'm struggling with him. I don't see why I have to put up with him all the time. I just want to eat with my parents in peace. But of course, that's not allowed because everything has to be comfortable for him. Despite the fact that I thought I was right at the time, they're making me feel guilty, and I'm having a pretty serious internal debate. So I bring my query to you instead. Am I the butthead, I'm saying here? Just adding that I've tried asking politely several times in the past, and he just ignores me. My parents also don't care on my feelings. They just want him comfortable. So talking to them is useless. What should I do? I love him, but this is driving me up the wall. Don't you just want to hug this individual?
I just want to hug her so bad. Yeah. So, Shannon, and I know you have a lot of thoughts. Please jump in on this one as well. I want to start out by just making a point of two things. One is you did nothing wrong. You absolutely have the right to say how you feel about it. And I want to talk about that a little bit in a minute. But the second point that I want to make is that your parents do love you just as much, but they're very overwhelmed and lost in what to do for him. And so I think they're just trying to do their best. And when later on, when you're older and have kids of your own, you'll see that a lot of times we think of our parents as all-knowing and they should know better. And honestly, our parents are just people as well, and they're pretty lost as well and trying to do their best. And sometimes they are so overwhelmed that they don't realize that they need to attend also to your needs because his needs are just so overwhelming for them. So, let's start with, I support you because I feel, not just because over the years, I've always talked to parents about how important it is for them to pay attention to the siblings because, as a parent myself, we get very lost in the fear of what is going on with my child and how can I accommodate my child on the spectrum and what can I do to give him love and caring and how do I just engulf him with my love? And we forget that there's a sibling in the room who also needs attention and has their own needs and all of that sort of stuff. As well as that, I think, honestly, one of the mistakes we make as parents is that we think we need to allow our kids on the spectrum to behave in any way they want to just because they have a diagnosis. And that's not the case. A lot of times when I talk to parents, I tell them, you should allow the things that you would allow of all your other kids as well. So in other words, have the same rules because our children on the spectrum will adjust to environmental rules really, really well. And so if your parents were to actually, if everyone in the household were to come to the conclusion that talking about cats excessively is something we want to get rid of or we want to reduce, it would be perfectly fine. It would be a really good thing that everyone would be able to tell him, this is not the time. We've already talked about cats this much of the day, X amount of time. Now at the dinner table, we're not going to talk about cats anymore. At the dinner table, we're all going to do something else. And that would be a wonderful thing. It would be a great intervention. It would help you. It would help him. Because I can guarantee you, you're probably not the only person who finds his conversation about cats to be a little bit too much. In his social world, he will also need to learn to talk about other things, because others will want to talk about other things. So you did nothing wrong. Please don't feel guilty about that. I think the best way to approach this is to have a calm conversation with your parents and to say, it isn't good for him or me. Explain to them that you're super frustrated and that you also need to have a little bit of peace, and you also need to have time with them, which is not focused on him. Just tell them those things. And also tell them, you've been looking into it and you've been asking experts, and it isn't necessarily the right thing for him either, for everyone to allow him to stay on the same subject. Any kind of rumination or repetitive behavior of that type goes against social norms. Social norms dictate that we are able to be flexible and that we pay attention to other people's interests just as much as our own. And I'm sure that's what your parents want for him. They probably just don't know exactly the path to get him there. I'll stop.
I love all of that. I don't know how old this sibling is, but I want to tell you that if you're 16 or older, there's a television show called Atypical that, especially season 1, is going to make you laugh because it's very parallel to your life. There's a sibling who has a brother on the autism spectrum, and on the show, he's obsessed with penguins, and everything is penguins, and she wants to pull her hair out. So I think that, there's a lot of sexual situations in the show, so I wouldn't recommend it to you if you're under the age of 16, but otherwise, I think, there might be some aspects of it that you would be like, oh, it's not just me. But I love all the things that Dr. Guanfacin has said. I think all of us as parents need to be aware of the fact that, we do need, I wasn't lucky enough to have a second child, but I know that for those of you who are, it's a balancing act and trying to figure out. But maybe if because the thing I heard the most in this is that I would like to be able to have breakfast with my parents in peace. And I think that's a reasonable ask, as Dr. Guanfacin said. And if it's something that you can't have breakfast, what about asking your mom and saying, once a week or once a month, can just you and I have lunch together? Can we have a lunch date together? Because sometimes parents they want to do something better. They want to do right, but they just don't know how. So if you say, I would like a lunch date, and, if your parents are willing to do as Dr. Guanfacin said, which is to say, okay, there's no discussion of cats at the table, or you get to bring up 3 cat things or whatever. If he violates it, that ask your mom, can I get up and go to my room to finish my breakfast? Because I want to get you set up for school in the morning without you wanting to throw things at the wall. But can I also say, I just think you're remarkable that clearly you're a writer. Clearly you have a very funny sense of things, because the way you describe things and them glaring holes through you are going to do well in life, my friend. And all of this that you're experiencing right now and all the emotions, I'm sure that there are people who are watching who are like, oh, I so get it. And that is a gift. And you're going to, I swear, the people that I, have the most affinity with in life, first of all, I just enjoy spending time with folks on the autism spectrum. But I got to say that spending time with siblings, these are the best people on the face of the earth.
I agree.
Right? So I think you're remarkable and are going to do remarkable things, but hopefully you can take some of Dr. Guanfacin's advice and start to get this train on track for you, because you matter. And I know you matter to your parents. They probably just, like, as Dr. Guanfacin said, they may not know what to do, but you're awesome.
I know they're exhausted. I mean, I want to say one of the things with parents is that parents just become exhausted, parents of kids on the spectrum, and they just kind of want to take the easiest way out. which a lot of times, if you stop, there's also a possibility that if they were to tell your brother not to talk about cats, he might tantrum or get upset, and then your parents would have to deal with it. And they're exhausted. And a lot of times parents will just avoid a situation that will cause extra work because they're exhausted. And it all makes sense. And we just have to, it's like, this is why, Shannon, they say it really does take a village when you're raising a child on the spectrum. It's so much work.
Yeah, but I think if you can watch that Atypical on Netflix, I think that the sister even has this thing with her brother where he starts to talk about penguins, and she holds up 3 fingers, and he gets to say 3 things about penguins, and she's like, "You're done. It's cut off. It's over. You don't get to talk about penguins for the rest of the conversation." And he's a little like, "Oh no, I gave up my 3 penguin things." But you see the relationship between these 2 characters, and I know from interviewing them that they have writers on the staff that were siblings of people on the spectrum. It's based in reality. I think you'll relate to it a lot. But what I love about that is that she has a very different relationship with her sibling than the parents, because of course. But it's a good relationship. And I so loved when you said, "I love him, but I'm finding him annoying." You can use these tools and you can have a great relationship with him. Okay, we got a bunch of questions that have come in. So for the person who wrote in and said, "I'm now clear," you're the person who wrote, and Dr. Grampy offered to see your child via telehealth. Do me a favor, email me again so that we make sure. And if that doesn't work, I'll give you a different email, because sometimes things don't come through the spam filter and I don't know why. But let's make sure. Hey, we're saying hi. We've got people from Ireland with us. So we're saying hi to a whole bunch of people. We have somebody named Argentina. I don't know if they're from Argentina, but, and they said that they love Atypical. I do too. And we're saying hi to MZ. Okay, I want to start in on some of these questions that are here. So we have the mom with us whose son had the traumatic experience at the dentist. And she has a follow-up question. They have the appointment with a psychologist coming up. They've started some new meds. But her question is, "We took a break from Zoom classes since he was having panic attacks and bad anxiety. It's been close to 3 weeks and he's still having them, but I'm concerned that he will regress if we take a really long break. But it was really hard for him to do a few minutes of work with his anxiety. What do you think about us taking a break?" And they said, "Thanks in advance for all of your help."
Sure. I think it's fine. I think you're okay. Don't worry. This mom has been struggling for a long time now. And I think you just should not be too concerned about this right now, because honestly, it's just so much work that you've been putting into it. Don't worry. Let's get him to see a physician first. Let's get him on some anti-anxiety medications. And then when you come back to it, let's make sure that your behavior analyst, your BCBA, knows as much as there is to know about his anxiety and what he's going through, so that they can really try to work towards him overcoming that. As behavior analysts, we never avoid anxiety, but because then you would kind of be rewarding behaviors that are escape behaviors, right? But basically what they would do is they would make sure to take it easy and go slowly and increase reinforcers so that he is able to overcome his anxieties himself. And medication will certainly help. Don't worry, you need the break just as much as he does right now. So just don't worry about it. Our kids don't really, when it comes to things like, a month break, there's not that much regression going on, and you can always go back. Okay, I'm just seeing they're waiting to start a program. So that's fine. You can just go ahead and wait until you get him on medication, and then you can start the program as well.
There you go. And for that, Mom, will you do me a favor and email me and tell me where you are, so that I can kind of keep an eye on you and help you to get started. that would be great. So email me s.penrod@autism-live.com and let me know where it is that you are. That would be awesome sauce. Okay, we've got a parent who says they've got a 5-year-old with ASD working on functional communication, and there is all of a sudden some new aggressive behavior, hitting and pinching. And he is doing that when he is calm. And they're wanting to know what they should be doing about that.
Yeah, so I think,
and I know that person does have an ABA program, Dr.
Great. That's terrific. So what you need to do a new functional behavior assessment and identify why he is hitting and pinching. It's very, very, I mean, unless he has pain, I can't think of a reason that he would suddenly start hitting and pinching without having a function. So in other words, there's got to be something that is leading to it, and it could be something as simple as when he hits and pinches, he gets attention. So he potentially wants attention, or he's trying to avoid or escape from a situation, or he really wants access to some object or some activity. So, you know, and I think I know who this mom is now, and
Yep.
you really do need to do an FBA. And
she says they did one and they're waiting to hear back.
Okay. So we just need to figure out what it is. And he does it only if it's only during telehealth, that's a little telling. It indicates that, you know, there's no one there to consecrate it in any way. And by doing that, he's delaying the telehealth instruction. So you still should wait for the results of the FBA, and you should follow up and say, hey, I need the results of this FBA because we need to have a behavior intervention plan. And it really depends on the function of the behavior.
Absolutely. So I love that. And as soon as you know what that is, we'll look forward to hearing that gets better. But I just want to remind for everybody that's there, this is such a foreign concept for anybody who's never done ABA before, Dr. Grampy-Shea, that there's a function for the behavior. It's like an oxygen supply. And, you know, we all do this. This isn't just kids on the spectrum. This was so enlightening to me as a parent when I realized, oh, we're all engaged in behavior all the time that has a paycheck. And sometimes it's just the smallest thing. But, you know, when I'm sitting here doing the show with you guys underneath the desk, sometimes because my hands have to have something to do, I pull my pant legs up and down. It's bizarre. And when we're in the studio, guests look at me like, what are you doing? And I will pull my pant leg up to my knees and then push them down again. And it's bizarre, but hopefully you guys don't notice it on camera. But it's what I do because my hands need something to do. Sometimes I have like couches and things like that, but it starts to be on camera. And so that's not there. But if we really needed me to stop this, if we were in a studio and we were seeing full body, I would need to stop it. But I would have to find some other thing to do with my hands. And if we just tried to stop the behavior without knowing what the paycheck is, we run the risk of doing crazy things that aren't beneficial.
Yeah.
Go ahead.
Sorry, go ahead, Shannon. No, I don't want to interrupt you, please.
Well, you know, the comparison I always give people is when something's going on with your car and it's making a noise, you don't just start ripping out all the equipment. You do a little bit of an assessment, or you drive it to the mechanic and you say, it's making this noise. And what does the mechanic do? He says, does it do it when the car is on or when the car is off? Does it do it after it's been on for 15 minutes? They ask a bunch of questions, and then they don't start ripping stuff out. They say, can I have the keys? I'm going to drive it around the block and see if I can make it do it. And we submit to that because we don't want them to just pull things out. We want them to assess what the issue is first so that they can fix it. And this FBA that Dr. Grampy-Shea is talking about is exactly that. They're going to ask you questions. They're going to spend time with the child and see, when does the child do it? What are the circumstances they do it with, so that they know before they start pulling things out.
Yeah. So it's really simple. I'm seeing a lot of comments on this. So I'm glad that you started to talk about the functions, because I see a little bit of confusion on the functions. So we should talk about that a little bit. So it's very simple. The functions, usually we talk about the functions and we talk about 4 different functions, but I like to bring it down to just 2 functions: human behavior. Everything we do is to get something or to avoid something. Always. There's just those 2 things. I want to get something or I want to avoid it. Now you take those two intentions and you divide them into 2. So what are some of the things that you want to avoid? You might want to avoid a task, for example. You might want to avoid a situation, like being in a classroom or being on telehealth. You might want to avoid, a demand. So somebody has told you to do something and you want to avoid it, right? And we also refer to that as escape maintained. There's a technical difference between escape and avoid, but you don't need to worry about that. Then there's the other side, which is gaining access. And what are the things we're trying to gain access to? We're essentially trying to gain access to objects, activities, foods, attention. These are all things that we want to get access to. So the first step is figuring out which one is it. And I was reading, I think the mom said, the things go so fast. She said he does it when he doesn't get what he wants. And so that's a really, really easy, tangible function. That's the easiest one, which is he wants access to something. When he doesn't get it, he has these challenging behaviors, right? Because what he's trying to do is just what we do when we're 2 years old, when we're 3 years old, or when we don't have communication. We're trying to communicate. I'm not really happy about this situation because I really want this thing. Now remember, emotions are not functions, because I know this mom also said, I think it has something to do with anger. He feels angry because he wants access to something he can't have or doesn't get, right? That's not the function. The function is just that he's trying to communicate. Remember, I always tell parents, all challenging behaviors are like language. They're a form of communication. So when I say, what is the function, you have to ask yourself, what would he ask for right now if he could talk typically? What would be the thing that he would communicate? Well, he would communicate, I want this thing and I'm pissed off that I can't have it right now. I'm angry because I can't have this thing. So instead of being able to say that, he's throwing a tantrum and doing all these other things. So what do? The treatment for each function is a little bit different, but it all has to do with the concept of do not reward that behavior. So if he's throwing a tantrum because he doesn't get what he wants, great. Make sure he doesn't get what he wants when he throws the tantrum. Let him tantrum. It does not matter. Let him have that challenging behavior. On the side, teach him to either ask for or point to or do some other more appropriate way of telling you he wants that object. Always ignore the challenging behavior or do not give in to it. And also at the same time, you want to teach the child what is the right way to communicate that you want something. And then you reward that. That's the key to ABA, is making sure that you don't increase those challenging behaviors by giving into them, but you model and you prompt appropriate ways of communicating what the individual wants.
And I know that mom says that, for instance, she puts away the dog and he jumps on her and starts biting her. And I just think, if we were able to narrate for the child and say, the child would be saying, no, I want the dog. Don't put the dog away. That's not what I want you to do right now.
Yeah.
But the thing that's significant for me is what mom said that I think is the crux of all of this is mom says, I'm tired of getting hurt. Been there, done that. And when you are tired and when you are tired of getting hurt, sometimes it's very hard to implement what you're being asked to do because it's going to feel so different than what you've done in the past.
Yes.
And I think it's really important, mom, that, you circle the wagons, see if you can get somebody to come once the behavior intervention plan is given to you that, I know sometimes you have some help that's there. Ask them to help you to implement this so that you can start it, because it's just so hard to do it on your own when you're tired. And it's not just tired. You're tired and hurt. And that is and when it's your child causing it, you get upside down fast, where you start to, you don't want to tell people because you're afraid of how they'll look at you. You're afraid of how they'll look at your child. You're afraid of being judged. You're afraid of your child being judged. It gets really mentally not fun. Yep. It's like a clown car in your head. So you're doing the right thing. You're asking for help. They've done the FBA. I would definitely write them today and say, hey, I'm a little bit drowning here and I need some help with this as soon as possible. I think that's reasonable.
Let me also give you some other ideas of things that might be helpful. And I hear you when you write, it breaks my heart because, it's so much. I remember when my kids were young, and it's so exhausting sometimes, when you just want to sit on the ground and just cry because you're just done, and there's no one there to help. And I understand that. And Shannon, as you would say, I want to give you an air hug because I know how hard it is. And I also know I really feel bad because I know that this parent is in the region of one of the areas where we had to close a site due to COVID. So, so we have only telehealth services and maybe a few therapists in the area. But I want to give you a couple of ideas and just a couple of pointers for all the parents, I think. One is that when you feel this overwhelmed, it's time to stop trying to fix things, and it's time to take a break from it. And the way you take a break from it is just that you choose your battles a little bit more carefully. You don't necessarily need to deal with this issue right now. Don't put the dog away. Doesn't matter. Take a break and take care of yourself a little bit. Because you just need to regain your energy and your own ability to deal with this. Second thing is, if it's an issue of putting the dog away, then do that when someone else is home. Ask for help. Get your husband and say, hey, I'm going to put this thing away right now, and he always tantrums and stuff, and I want to make sure that when I put it away, he's not going to hit or bite me or jump on my back. So I need you to either, and he can do two things, either immediately redirect him to some other activity, or I need you to model for him so that he knows how to ask for the dog back. So that's another thing that you could do, is just deal with this object and putting removing access for this child to this tangible object only when you have someone else there. So that's another thing you can do. The other thing is that, believe it or not, as bad as it is, and if you could get help so that he's not hurting you, our kids very quickly adjust to schedules. So one of the things you could do is you could allow this dog, this toy, a certain amount of time. You could say, you can have access to this thing from, breakfast until lunch, but not after that, or the other way around. It's disappeared, and it's going to come back only when dad is home, or however you want to do it, so that it is not a constant struggle. It sounds to me, just from reading some of the things mom is writing, that there's an idea that the child also has sensory needs, which is why this dog is there to begin with. And they're doing a lot of other sensory activities as well, I saw. And that's great. Sensory activities can sometimes be calming for children, but the bigger issue here is access to this object. And so when, taking away access, just know, hey, this is a task. This is when he's going to get violent. This is when he's going to get frustrated and angry. Maybe I should prepare him by giving him exactly a way to ask for it back that's more appropriate. Maybe I should prepare me by having another individual here. And maybe I don't need to do it 5 times a day. I only need to do it once in a while so that it is not something that until I'm more prepared. Get your own team together. Focus on that. A lot of times as moms, we just, or dads even, but we're alone and we just take on such a huge burden and it's just overwhelming. And it breaks my heart when I see a parent say I'm in survival mode. I get it.
Yeah, but I think when you get that results of the FBA back, that's going to really help. I got to move on to some other questions because we've got so many coming in. We've got a 4.5-year-old nonverbal. They want to increase joint attention. He's aware of his family and doesn't interact so much, but also has separation anxiety when we're not there. So they want to increase joint attention, 4.5-year-old nonverbal, Dr. Grampy.
Okay, so I don't think that you need to be looking at joint attention right now. I think at 4.5 nonverbal, the priorities should be a little bit different. You just mentioned a lot of stuff here. Separation anxiety is its own thing, which we need to also work on. But joint attention, I'm not sure let's talk about what joint attention is. Joint attention is the ability to be able to share minds and be able to look at an object that you are looking at and read your intention, or the other way around, is to be able to really show you what I'm thinking about by, for instance, looking at an object or pointing to an object, so on. Is merging your attention with mine or mine with yours. That's what joint attention is. And it's a little bit of an advanced skill for a 4.5-year-old nonverbal child. So you might be referring to, you just want to increase his attention. I don't know. Maybe you can write in and talk to us about that. But if I were to suggest something for you at 4.5 nonverbal, it would be all about teaching communication. My focus would be communication. Like I was saying earlier, when our kids can't communicate, they become frustrated and angry and they do all kinds of challenging behaviors. So the focus should actually be much more on teaching communication right now. Whether it is verbal or nonverbal, it doesn't matter. A lot of our children who are nonverbal learn to verbalize, learn to vocalize. So I don't know if you had intervention, not just speech therapy, but both speech and ABA focused on teaching sounds and words and the production of vocalization. If you have, maybe you're in the middle of that and you just continue to develop that into what we call manding and tacting. That means using those utterances to request things, using those vocal utterances to identify things in the environment, etc. And if you have come to the conclusion that vocal communication is not going to happen, then you should really be focusing on non-vocal communication, like a picture exchange communication system, which is iconic communication, icons, pictures, or just keyboarding and typing words. Some form of communication is really where you should be focusing.
Okay. Continue on. Sade wants to know, she's got a 3-year-old in ABA. They have speech OT. They were allocated 24 hours of ABA, but she only sits through about 2.5 hours a day, 6 days a week. So that's around 12 hours, she says. They started ABA in October. They're having it in the home because the child can't wear a mask, so they can't go to the center. And she's asking, she really wants to encourage language in this 3-year-old, that there's some language, but not conversational. So, and this 3-year-old is able to read, but yeah. So anyway, October of 2020 is when they started ABA. So, but they're only getting like 12 hours a week.
Right. So, I mean, I think, you know, and as the founder of CARD, which is also an ABA provider who also lost 1,000 or so behavior technicians during COVID, and is also another provider that has a shortage of therapists, I understand the provider side. But as someone who cares deeply about our kids, and I'm trying to kind of help you and advise you parents, I would say you need to have a really increased number of hours. And I just read that the same parent said the child won't sit through more. If the child won't sit through more, there's something wrong with the ABA. For having started in October, it needs to be fun. By now, you've had about 6 months, 5 months, and they need to increase the reinforcers significantly so that your child will sit through more. And you need to call the company that you're with and constantly ask for your other 12 hours. Even 24 is on the low side. And you need to, if they are not able to provide you with people, then you need to either change your provider or actually just even find, this is the way I tell parents to kind of help empower their providers, find capable young people and refer them to your provider so that your provider can train them. At least this is what we do at CARD. If you're a parent with CARD, please refer anyone who has just finished high school. The only requirement we have is that they must have finished high school. We will do all the rest. We will train these individuals very well and make sure that they are ready to come and work with your child. Keep telling your provider that these cancellations are not working. Everything you wrote in here makes sense. It's terrible when the therapists cancel, when there's a constant influx of new people, they take time to get your child. It's just a constant thing. You don't need a reevaluation. The parent just asked, should I request a reeval? You don't need a reeval. You just need, I assume you have a board certified behavior analyst, the BCBA. The BCBA needs to increase reinforcers and make the activities a little bit more fun, and then gradually increase demands. I hear you. We just need to be kind of squeaky wheels when it comes to our kids.
Absolutely. You know, and I loved, I don't know if you noticed, I was applauding because, you know, a lot of times people, because in fact, we have somebody ask a question about, let me go to it, because Bernadette said something that broke my heart. Bernadette said, we worked with CARD for many years to learn and support a now adult with ASD. Always lost and shocked as to what to say when I hear professionals who speak so negatively about ABA and any advice. And I'm with you, Bernadette, that I hear this all the time, that, you know, all these people will say all these negative things about ABA. And I'm always saying to people, are we talking about quality ABA? Because there is such a difference between quality ABA and this schlocky thing that a lot of people seem to be doing now that they call ABA. And there are many different things that are the hallmark of ABA, but you just heard good ABA, quality ABA. You just heard Dr. Grampy-Shea, one of the biggest ones, which is it's not something wrong with the child. If it's not working, it's not wrong with the child. If they're telling you, well, we can't do more ABA because he or she won't sit still, then that is not good quality ABA. That is like, boom, red flag. And it's them, not your child. And if you are ever hearing an ABA provider saying, well, we can't do that because your child can't do that, I would say to you, it's time to have a real heart-to-heart with them because they're not the right people for your child.
Yeah. And I think the parent just wrote in a very, very good question, which is what is quality ABA? And we should maybe spend a couple of minutes on that, because I think it's a really important thing for everyone who's listening right now. There's many features to a good quality ABA. It's, on the one hand, you want to make sure that the provider has done training with every single individual. I was shocked the other day to hear that an organization that is led by two individuals who actually used to work for me at CARD, and I thought very highly of them as supervisors, as BCBAs, don't provide training when they hire people. And I was shocked to hear that, because that breaks my heart, because you getting a young person in your home who comes to the parent and says, I have no idea what I'm supposed to do. That's not quality. That's a good example of what is wrong. The people coming to your home or working in a center, and that's why we it's one of the reasons we prefer center-based, because our BCBAs are there and they get to see everything. But the key to it is that they should be well trained in the techniques of ABA. So that's one thing. And you have to have a BCBA, a board certified behavior analyst, or a licensed individual who has a lot of experience in this field, like a licensed MFT or PhD, and they should just have experience in the field. Now, that is one side of it. The other side of it is that those individuals should spend a lot of time with you. So the behavior technicians should be doing an adequate number of hours, which really is different for each child. If you're doing a comprehensive program, which means if you have a young child, a child below the age of, let's say, 6 or 7, then your hours should really be not less than 20. You should be working on a pretty global program. That means you're trying to teach a multitude of different things. So you need 20 to 40 hours a week of therapy. 5 hours is not going to teach your child everything they need. If you're past that age, and if you're more focused on one thing or another, let's say you're a teenager and you're focusing on, table manners, or getting a job, vocational skills, or something like that, then you could do a more focused program, which would be more like 10 or 15 hours, just focused on that one task, one skill. So the hours matter, and also the BCBA hours. So the amount of time the supervisor spends with you, it matters. So the first one was the quality. The second one is the intensity, the hours. The third one is parent training. So you really, the more you know and the more you're involved, the better everything is going to go. And I promise you, it'll just make sense to you a lot more, and you'll be able to catch the therapists, and you'll be able to catch the BCBA, and you'll be contributing, and you'll feel very empowered, because you'll be able to also tell people, like, oh, by the way, this, and I saw that, and this hasn't generalized, and how do we do this, and so on. And so you'll be more of a part of the team, and you're the one with the child all the time. So you will be the most important player on that team once you're trained. So that's another really big part of it.
Can I interject there, though, Dr. Guanfacin, that it is so essential that parents learn these things, but not to the extent that it's the only thing. Somebody just wrote in and said, I'm currently changing providers because our supervisor said that increasing hours is on, and then added that they are only here to teach us parents ABA. And that is not a hallmark of quality ABA either. So they should not be there just to teach the parents, but they should also be teaching the parents. And any supervisor who says to you that increasing your child's hours isn't going to help your child, like, I would like for them to report that BCBA to the BACB, because that is against all the science that there is.
Yes. There are programs out there that are just for parent training, but if you are in a program that is intended for your child and your child is not making progress, that really has nothing at all to do with we're only here to train parents. That's not correct. That is definitely not correct. So that's that. There are other aspects to another aspect to a quality ABA program is that you have a really, I guess, collaborative is the word I'm looking for, or you form a very tight bond and team with your supervisor. That's super important for me. When I was treating patients, I would spend hours just listening to the parents because I want to make sure that I see things from their perspective and that they can understand the way I'm seeing things as well. It has to be a team effort. If there's disagreement between the parent and the supervisor, it's just more tension for you. And it just doesn't work because the supervisor is supposed to be the person that takes your wishes and interprets them into ABA and tells the staff what to do. So you have to have a really good bond there. And that's really, really important. And honestly, so I was talking on a whole different subject the other day, and sometimes it's not even about the quality. There are people who are very well trained, but they have their own personal issues that are preventing them from being good clinicians. And they are just, not able to sit and listen to you. They become defensive, perhaps, or they want to be the center of attention. There's all kinds of personal things that come into play as well. So I guess those are some of the important things. Hours. Please, Shannon.
I want to squeeze in. I really want to talk about this subject more, but I really want to squeeze in this last question before we go. There's an individual who is now constantly playing with his spit. This is a nonverbal at a double level 3. He does it when he's bored, while he's playing, after he gets in trouble. It really doesn't matter what he's doing in the day, he will play with it. It's distracting him during bedtime, and it's giving me overload hearing him play with it in his mouth. It makes me want to gag. How do I put this on extinction? He won't chew gum. I give him bubbles and Play-Doh, and it's not working.
Yeah, so that's a really tough one. I don't want to give you a quick fix in 2 minutes just because I don't know if you've done a functional behavior assessment. Like everything else, I remember I had a child who used to spit out and at people, and we always thought that the function of the behavior was that he was trying to get people to leave him alone. So he would spit at them and then they would leave him, right? Because they'd go to wash their face or whatever it was. But it ended up being that after we did an actual experimental functional assessment, analysis, which is a little harder to do, we realized the reason he was doing it was the sensory impact. It was, he liked to see how the spit was going in the air and hitting the person. So it was a completely different function. So I don't really want to give you advice on this because I don't know the function of the behavior. I think you need to get a BCBA again to kind of look at all the antecedents. That means exactly when is it happening throughout the day, and you could start writing these down, and exactly what happens when, what does anyone do when it happens? Is he given gum right after he does that? Is he told not to do it? Whatever the consequences currently, put those in writing, and then let's talk about it next time.
Okay, and she says she is taking the ABC data, so share that with us, Kristen. In the interim, you know how to email me. I do just want to say in parting that the other mom said that the BCBA told me the quality of ABA, fun and enjoying it for my daughter, is more important than the hours she's scheduled for 4 hours a day. But right now we are subbing with a therapist who works. At the end of the day, I agree that it's fun. It's got to be fun. It was that thing we were saying before about it's got to be fun. It's got to be reinforcing, but they've had since October. Come on.
Yeah. And it's very possible to be fun, but also to learn.
Yeah. Yeah. Look at PBS. They've perfected that. Right? PBS knows all about let's make it fun, and then they will learn Sesame Street. I rest my case. Hey, I love all of you. Somebody wrote in, can you please talk about children being affected by the COVID virus and acting differently? That's a whole other episode. We'll have to save that for another time. I'm so sorry we don't have time right now. But I love all of you for participating, even those of you who are just listening and didn't write in. Thank you so much for being here, Dr. Grampy-Shea. I love and adore you. Thank you for all the work that you do for our community and for this time. Tomorrow, we are back, and we've got a pediatric dentist who's going to be here with us to talk about dentistry, autism, and COVID, and how we can't let these things slide, and things that you can be doing to help your child with, during this time, so that we don't have dental problems, because that's become an issue. So that will be tomorrow. And on Friday, we have Kurt Manichek back. He does the Smile and Success program for teens, teaching social skills and pre-employment skills. And he's got an online class right now. So if you've got a teenager with some time on their hands, you're definitely going to want to be here for that. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now, you guys.
Bye-bye.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.